Okay, so today we are going to talk about the difference between a hospital, a freestanding ER, and an urgent care, and when do you go to what? So first of all, I would like our participants to introduce themselves. So Pamela, we'll start with you.
Hi, my name is Pamela Kapik. I'm a board certified emergency medicine doctor, and I'm the medical director for the ER of Texas location in Mansfield.
Okay, Libby.
Hi, I'm Libby Vogt. I am a physician assistant, and I have been working for about 4 years, and I work for Community Med Urgent Care in Mansfield.
All right, excellent. All right, so let's just open it up with, let's talk about, I don't even know how to start it, but if we're going to look at those three different entities, let's talk about a hospital first. Let's do that and then work our way down. So when someone goes to a hospital, what's normally the primary reason they're going to a hospital?
Libby, you want to take that or you want me to?
I mean, you can start since you're in the hospital setting, or I guess in the ER setting, and then I can add in if you need me to.
So, it may be easier to start lower acuity to higher. Do you want to maybe start with the urgent care setting and move up from there? Because it might
fine. Whatever makes sense for you.
Okay.
Yeah.
You start, Libby. And
Okay, so I can go. So I mean, what walks through our door, I guess, is the first question, right? So everything and anything. And I think that's probably the same thing with the ER setting. So most people, and that's why we're having this conversation, right? So most people will just kind of present whether or not their acuity is very high, meaning are they bleeding out, or are they having chest pain, or have a little cut on their finger, all of those things, to a cold. So I would say starting off with urgent care, I think the main question is why go into urgent care versus emergency room or emergency department. And I think I can start off with, if you're not feeling well, come in. We will see you no matter what. That's, I think, the bottom line there, right? So we won't ever turn you away because we can't see you, but we may send you off to Pamela for further investigation, right? So I think it's the most basic thing. And what we see here in the urgent care is family medicine sometimes, because a lot of the times they can't get into their primary care. So we'll be seeing them for med refills, broken bones, cuts. But then it also goes all the way up to people who are having chest pain, who are ultimately having heart attacks or strokes. So do I think that, and I think that's probably, Lori, where you can follow up with some questions, but that's when we can decide or help you or guide you into a way or a place to go, depending on what your symptoms are.
Well, and I realize that that you'll see anybody that comes to you, but I think in certain situations, isn't it more appropriate for, depending upon what's going on with you, for you to not go to an urgent care, but maybe go to an ER or a hospital? I mean, like, especially if you think you're having a heart attack.
Of course. Yes. And so I think that then that becomes very patient specific, right? Because there's people who have chest pain, but it's due to coughing so much they're having pain in their chest or inflammation in their lungs, to having a full-blown heart attack. And that's where, I mean, if Pamela, if you want to step in on talking about some of those emergent signs that people are looking for, to where they should probably be going to an emergency room.
Absolutely. And I will say that we love our partnership with you guys in the urgent care, because you guys are located right across the street with us. And I can't tell you, probably every shift I work, they'll give us a call and say, hey, I've got this patient here. They're not appropriate for this setting. Can you guys see them for us? And they send them over and we can take care of that patient. So they're very good at, number one, making sure the patient's stable and making sure they don't need to call 911, and then getting the patient to the appropriate setting. Patients have a hard time choosing between urgent care and departments because, number one, the cost is very different. And number two, a lot of people just don't have the medical knowledge to say what setting is appropriate. I think you've got an urgent care as kind of your something that could be done at a doctor's office, something where you're not very far off your baseline. You feel pretty good, but there's a minor illness wrong, a simple cut that's not bleeding profusely, a cough or cold where your respiratory status is not compromised, meaning you're not super short of breath or having a great deal of chest pain or super dizzy when you get up and try to walk. So when not quite right, you think a doctor's office could handle it, and you don't think you're going to need to be admitted to a hospital. I think they can handle a lot of broken bones, Libby, correct me if I'm wrong, that aren't dramatically out of place. So if you think you have a broken toe or a pinky or something like that, but if the bone is obviously disformed and looks like it's going to need some tugging on it to make it, probably not. Do you guys handle facial lacerations or not usually?
We do, yes. And I think it depends on the extent. We have a conversation with the patient and we have to let them know, we're not trained plastic surgeons, right? And we can, if it's minor, but obviously if it's gaping, we usually will refer to the ER so they can get a consult with plastic.
Right. And a lot of times the urgent cares are now staffed by physician assistants, nurse practitioners. There may be a doc there, sometimes may not. When you come to the ER, there are board certified docs there, at all times too. So that level of care is a little bit different in that regard as well. Does that when to choose urgent care versus ER?
I think so. I think when Libby said the fact that if you can't get in to see your general practitioner, I know that's when I go to an urgent care. It's logical. It makes sense. It's not an emergency. Now, if it is an emergency, what's the difference between the ER and the hospital?
And that's something I really wanted to kind of help clarify, because a lot of people think of a freestanding ER as an urgent care. And I want people to think more of a freestanding ER closer to a hospital-based ER than an urgent care, because we are very different than an urgent care. We have a lot more capabilities, and our capabilities are closer to an emergency room in a hospital than the clinic urgent care setting. And the price is reflective of that. So when you choose to come to us, a lot of people are shocked they're getting an emergency department copay and that type of bill, but they are getting the same services that they would receive at a hospital-based ER. So 90% of what a hospital-based ER, a freestanding ER can do. We are all docs who have trained in emergency medicine, who have worked in hospitals for a long time. Our CMO worked at Methodist Mansfield for a long time. I worked at Charity Hospital in New Orleans. I worked at Baylor. And we're just doctors who wanted to practice emergency medicine in a different way to give patients a different experience. So we can handle 90% of what an ER can handle. We can handle chest pain. We can handle shortness of breath. We can handle broken bones. We can handle nausea and vomiting that you need IV fluids. We can handle infections like cellulitis or abscesses. There's a lot of stuff that we can handle that we don't need to send to the hospital. The things that say to go choose a hospital-based over a freestanding based are, number one, we don't have a blood bank. So if you are bleeding a great deal and think you might need a blood transfusion, a hospital base is always the way to go. Things that are time consuming. So if you're having stroke-like symptoms, weakness on one side of the body, and acute findings of slurred speech, altered mental status, or weakness on one side, I would say choose a hospital-based ER over a freestanding ER, because in that regard, time is essential of how fast you get to treatment. And I would say the hospital can treat a stroke much better than we can treat it. If you're so unstable that you feel like you cannot get to an emergency department, so say you don't feel like you can drive, you're too short of breath, you're too dizzy, you're too weak, and you need to call 911, I would say choose a hospital-based ER. Okay. So People that are that unstable are likely to get admitted or likely to need ICU level care, which is things we don't do. But other than that, most complaints that the hospital-based ER can see, we can see. There's often no wait. You get one-on-one treatment with a doctor who didn't want all the craziness of hospital-based medicine and all the red tape that goes with it. We can actually take care of patients with appendicitis and get them on IV antibiotics, and I can arrange for them to have surgery the same day or next at a day surgery center. So we have a lot of ways to creatively keep patients out of a hospital and treat patients in a more private setting.
Okay. So talk to me about insurance.
So insurance in Texas, you're very protected. You will be required to pay your copay. So whatever your insurance charges for an ER visit copay, we charge you. And then it goes to the insurance. And then in Texas, you have laws that say, if the patient feels like they are being seen for an emergency condition, the insurance is obligated to reimburse the provider at in-network pricing. So even if we're not in network, we have to bill in network. We don't balance bill. And the laws in Texas are very protective for patients' rights in that regard. So it's actually very helpful for patients that even though Blue Cross Blue Shield or these major insurers won't negotiate with us, they still have to pay us in-network pricing, and the patient doesn't get the brunt of the bill.
Okay. So why do you think people get so confused as to the difference between the three? I mean, and I hear this all the time. I mean, especially when we had such a surge come into Mansfield, there was a lot of confusion as to what is what.
I can kind of speak to that a little bit. So I think a lot of the times it's either confusing or it's the wait times. I think a lot of the times that plays roles into that, because what will happen is someone will go to see either their primary care, they can't get in for 2 weeks, or they even come to an urgent care, depending on, I guess, most of the time it's probably time of year, right? Flu season, COVID season. And if they can't get in, well, they're going to say, oh, I can probably get into either an urgent care faster or an ER, right? Because an ER can't decline me. They, per law, they have to accept these patients. So I think that that's one of the reasons where they may not be confused. It's just faster care for them. And then, but I think where confusion can happen is urgent can be urgent to the definition could be so confusing to people.
It's
right?
urgent to me.
Yeah, exactly.
But not you.
Yes, it's urgent that I have a sore throat and I can't swallow and I talk for a living, I mean, so I think that that's where the definition varies between people. And and I also think that what gets confusing is urgent cares. Depending on what urgent care you go to, there's a broad spectrum of what we can do. So I've worked at a couple of different urgent cares, and one urgent care, there's no blood work done. We will do some send out labs, but it's very basic. But then there's another urgent care that we will draw heart enzymes if we think you're having a heart attack. So it just ranges. And I think that that's very important when you're contacting or trying to make an appointment with an urgent care, is asking, can you handle this? Or asking a little bit more specific questions. And, I can't speak to how someone's going to answer those questions for you, right? But it's, what are your capabilities? Hey, these are my symptoms. Do you think you can see me for this? And I know that they are limited on giving medical advice over the phone, but a lot of the times, if they can handle it correctly, they'll say, come on and we can see you and evaluate you. And or some people are very specific. I want an ultrasound because I have XYZ issue. And at our urgent care, or I would say most urgent cares, there's not ultrasound and there's not a CT machine. We do have X-ray. So I think that's where the confusion gets people is, that they don't know the kind of capabilities that the facility has. And
so then they vary. You're telling me that the capabilities vary urgent care by urgent care. Is that the same with the ERs, or are they pretty standard?
Most freestanding ERs are very standard. And
Okay.
there's so much confusion, is freestanding ERs are a new thing. We are actually, Texas, once again, is very lucky because they're one of the few states that has allowed private people to open freestanding ERs. And there's only a handful of states in the company that actually allow it. It was done to take the stress off the hospitals, to take the wait time off the hospitals, to allow more inpatient beds in the hospitals to open up. So it gives patients a choice of where to get their care. But the concept is still very new and still evolving. All freestanding departments are regulated by the state. We all have in-house lab testing capabilities. We all have X-ray. We all have CT scan. We all have ultrasound. We all can do IVs. We all can do IV fluid. We all have IV medications, and we can all admit for 23-hour observation. So we can keep you for up to 23 hours, trying to get you fully back to normal, or trying to see, hey, can we get you better, or do you need to be transferred to a hospital? And when we transfer you to the hospital, we try to transfer you to an inpatient bed so we avoid another ER stay. But the concept is still relatively new. When I started training, these didn't exist. They've probably come about in the last 5 to 7 years. So when patients see a setting outside of a hospital, they automatically think urgent care. But like I said, that's what I really wanted to explain to people is we are not an urgent care. You need to think of us more as an emergency room, but a very nice, friendly emergency room that's easy to access.
That you can get into.
Because all of us, we've been there and we've seen the patients wait, and it breaks our hearts that we don't have the time to spend with patients and really talk to patients and get down to the bottom. And, we used to get our hands slapped at a hospital ER for ordering too many tests or spending too much time because honestly, there's too many patients waiting in the waiting room to get through everything. That's not the case in the freestanding ERs, and we can address every complaint. We can order whatever tests we think are necessary to get down to the bottom of the question. So I think it's just a new concept, and people aren't used to what our capabilities are.
Yeah, I think you're right on that. And the fact that we are all in such a immediate need for whatever it is that we want it now. And so it's like dialing for dollars. Who can give me the appointment the soonest?
Yeah.
Okay, so is there anything that you want to add before we close out that I didn't cover or we didn't talk about?
I can add in a little bit. I know we touched on the insurance part for the freestandings. The insurance parts for when it comes to urgent care, it's also dependent on the company, on what kind of insurance they take. So I know certain companies will take all types of insurances, and then it's almost like a primary care, right? So you have to call and see if you're in network or not. But also, I think what's great about if you're not in network with us, or you don't want to pay your very high copay or whatever fee you have to pay, we do have cash pay, and I think and I'm assuming maybe Pamela, y'all do too. You do too, but the cash pay price as well is a very great option too to go off of, and it's pretty reasonable for what you get. So I would just encourage people that if they don't have insurance, it's okay. You can go and be seen at an urgent care because we do have those pretty reasonable cash pay prices when you compare it to a full-on hospital ER.
Absolutely. Yeah, I agree with that. We do the same process. We bring every patient in and we do a medical screening exam on them. So we would never not treat a patient if they're unstable because of ability to pay. So we always they're stable. We always make sure there's not an medical emergency going. prior to talking to the patient about funding. And then obviously if you have insurance, we take all commercial insurances and Medicare. We are not in network with TRICARE or Medicaid at this point, but we're working on it. Most freestandings do not take Medicare. I will warn you of that because being new, the government still isn't fully on board with, the freestanding ERs yet, but I think that's coming around when they see the offset of the main hospitals. But also our cash pay pricing, you're right, is actually very affordable, and it gives patients access to medical care that maybe couldn't have afforded it in a hospital setting as well.
Okay. All right, great. Well, listen, I appreciate the conversation and the information, and hopefully people are getting used to the concept and know how to or where to go for what they need. So I'm going to close this out, and thanks again, guys.